as you probably know, and in general, there is a huge number of different studies evaluating the performance of different plasma biomarkers compared to clinical diagnosis of Alzheimer's disease. But when we want to evaluate the predictors of these markers, of CSF markers, the story is even more complicated, because we know that at population levels, different markers, especially p-tau 231 and 181, they are very good performer at population level. But if we want to go at the individual level and predict the different CSF markers, then it's not very easy. Because we have a lot of patients which showed also CSF intermediate levels. So in this study, we try to figure out a very diagnostic head-to-head comparison between CSF and plasma, and we try to figure out how can we use the plasma biomarkers to predict CSF core biomarkers. And we found that, of course, we should use p-tau 181, which is a very solid biomarker for a first step screening. And then we have two populations. We have positive to this marker, so with a very high likelihood ratio to have Alzheimer's disease. And then we have also patients which who are negative. So if we consider the positive to be sure that they have an Alzheimer's disease, then we should consider other biomarkers. And we found that the combination of amyloid markers was very, very, so can have an added value for the prediction of Alzheimer's disease in these positive cases. And in negative cases, how can we exclude false negative? We can exclude a false negative performing a different p-tau marker, for example, p-tau 231. And we found that the positivity of only one of two p-tau markers could indeed indicate an Alzheimer's disease process. So probably the combination of these biomarkers can add to the clinician the more diagnostic accuracy, even in subset of patients and even at individual level, and not just considering the big cohorts or a big sample of at high risk population.